Over the last 4 years, the UK Department for International Development has invested over £30 million in the Multi-sectoral HIV and AIDS support program in South Africa. This huge program, which partners with all sectors of society, is strengthening the country's response to the HIV and AIDS epidemic. It has touched the lives of an estimated 5 million people. In partnership with government, the private sector and civil society, the MSP has supported the National Strategic Plan for HIV and AIDS. Over 100 projects focused in 4 provinces have been supported and funded. Civil society organizations have played a major role in many MSP projects. In Eastern Cape, the MSP-supported Treatment Action Campaign has fundamentally improved the lives of thousands of families affected by HIV and AIDS. Phumi Kweza is an HIV-positive mother. After becoming seriously ill in 2004, she was tested for HIV and was placed on an antiretroviral treatment regime. Through TAC's treatment literacy program, she received the correct treatment to prevent the transmission of HIV to her child when she fell pregnant in 2006. Her son Kwezi was born HIV negative. He's now 18 months old. Through consistent testing, regular checkups, and single feeding, Phumi is doing everything to ensure that Kwezi remains negative. Phumi is now known as a committed TAC activist, encouraging pregnant women to know their status and to reduce the risk of HIV transmission to their babies.
I did not worry that Kwezi will be born HIV positive because through the education of TAC, I know that a child can be born HIV negative, meanwhile the mother or the father of the child is HIV positive.
To help more mothers like Phumi and more children like Kwezi, the MSP has funded 4 research projects in KwaZulu-Natal and Limpopo. These projects test service delivery models that will significantly improve HIV prevention policies. Whilst these projects offer hope for children and access to antiretrovirals is increasing dramatically, there is a rise in the number of people dying from HIV and AIDS-related illnesses. In South Africa, life expectancy has dropped from 65 to 50 within the last 10 years. Palliative care prolongs and improves the quality of life, reduces stigma, and allows people to die with dignity. MSP supports WITS Palliative Care Centre's innovative outreach and training program.
The MSP support for palliative care has been absolutely strategic because it's allowed us to set up a centre of excellence. We have trained over 650 doctors at WITS Medical School, where palliative care is now a compulsory subject. We have been able to provide support to departments of health in other provinces, for example in Mpumalanga.
This benchmark palliative care project has now been adopted by the Gauteng provincial government.
We have taken cognizance of the fact of people's needs around death and dying. People are quite happy to engage in our services because they are sensitive culturally. We don't have a one-size-fits-all model.
Teams of nurses have been trained to provide home-based palliative care.
I think it's better to allow the patient to die at home because it's more comfortable than in the hospital. The majority prefer to die at home, where they are next to their families. They are given all the care and the comfort.
Hello, Mama. How are you?
All right.
Sometimes when I visited her at hospital, she used to cry. Oh, it's better for her to be at home than in a hospital, so that maybe sometimes, you know, there is somewhere where she needs a parent. It helped me a lot. I become relieved. I can see that I'm getting somewhere, because I can see that there's somebody who is helping and taking care of us. because they tell me what to do and they help me out. They order medication also to come and give the patient, and then life goes on.
Significant contributors to South Africa's high rate of HIV are domestic and gender-based violence and rape. The MSP-supported rape study conducted by the Medical Research Council in 2 provinces found that from a sample of 1,700 men, 28% admitted to committing rape. In response to these shocking figures, the Medical Research Council, together with the National Department of Health, has developed a training curriculum that improves care and support for survivors of sexual assault and rape. The curriculum has been adopted in 8 provinces for training health workers and has aided police and justice officials.
Have you all encountered that? Would you all agree with that? It has a huge impact on women, and so they're much more vulnerable to getting HIV. And I think our curriculum has got an important role to play in rape prevention through helping the police and the criminal justice system with their ability to follow through on cases, apprehend perpetrators, and bring as many of them as possible to justice.
The partnership with the Medical Research Council is a priority for the department, and basically you might have heard about 16 days of activism against domestic violence and gender-based violence. The government of South Africa extended that to 365 days of activism against gender-based violence.
As the HIV and AIDS epidemic matures in South Africa, the number of children at risk is on the rise. It is estimated that there are over 1 million orphans and vulnerable children in South Africa, and more than 2 million on social grants. Unathi Zali is a volunteer with the MSP-funded Caring Together project.
Le project lena ibanceda ohlobo abantu kukho thina caregivers ngoku ikhona change eyenzekileyo ku community, because nathi ke ngoku siyanceda apho sithatha abantwana sibase clinic so bafumana ARVs, abanye ngokubona asana uba umntana utyi treatment okanye akayityi kuzufanda uthi into oba la mntana utyi treatment okanye kwenzeka ntoni, uyusuka esikolweni uze endlini uzokwenza home visit.
The multi-sectoral nature of the project is key to its design.
We are outside Nompumelelo, which means success. The school is one of our success stories, but this is such a different program because it's a school-based program. A school-based program where we're actually drawing in stakeholders and partners from different government departments, community-based, like the churches are involved here, you know, other schools are involved here, and many can learn from us.
The Eastern Cape Department of Education will sustain the initiative in the current 100 schools and is expanding the project to a further 300. Caring Together provides a safety net for the most vulnerable children, giving help when it is most needed and ensuring that they receive sustained support. Four years of hard work and 450 million rand of MSP investment has achieved impressive results across all sectors. New strategic partnerships have led to groundbreaking research, improved policies, and an expansion of services. Driven by a common vision, these partnerships have improved the lives of millions of South Africans affected by HIV and AIDS. But there remains much work to be done. Realizing a generation free of HIV does not rest with government and donors alone. It rests with all of us. Activists, community leaders, social and health workers, policymakers, researchers and carers, making a difference and changing lives.